Hey, good evening. This is another case of number 17, wisdom tooth consideration, how to handle it. The panoramic x-ray showed that the tube is pretty erupted. However, clinically the patient have just partially the coronal side that erupted, and the patient had pain. Now, if you look carefully, you will see the distal part of the tube have a sort of like bone loss area. That is a chronic infection due to accumulation of the calculus on the distal part of the tube, and the patient have nowhere to clean it, as you can see right there. So in this particular video, the reason we put up this video is to show the dentist things to consider, how to handle the 17 tooth extraction in the most effective way and the most conservative way. So in this case, I evaluate the x-ray before I pursue the procedure, and the root is separated. So that's a good indication that you can, if you section the tube in half and you leave the piece of the lingual surface, you can use the elevator and twist it, and the root should separate them in two pieces, and then you just use the 151 forceps and pick up meso root and then distal root pretty easily. The things that you learn in this particular video is you do not cut the lingual chrono side, okay? You leave like half millimeter, something like that, and then you just put the elevator and twist it, and it will separate, and that's how you don't damage the lingual bone. There is a lingual nerve and the inferior alveolar nerve down there. You have to be very careful. Thank you for watching, guys. Hope you enjoy the video. In this again, if you can see there is the distal calculus on the distal surface of the tube that the patient have no way to clean. This is the reason why he continually have a pain on the gum, and as you can, if you look carefully, you see the distal bone loss around that area. The distal bone loss can get bigger and bigger, and to the point where it's no fun to have a big abscess removed. So indication when, how, you look at the space, whether the patient is have a big enough space so you can go in with the surgical bird, or you have to refer to the oral surgeon. How old is the patient? It's a good time to remove. If the patient is really old, bone dense is really dense, and the root is really long, those are things that you have to be careful and know exactly whether you attempt to do it and you don't run into the trouble. And it's not fun to run into trouble and refer to an oral surgeon. You should decide when it's a good time to refer, when it's not to refer. Thank you for watching. Have a good day. Bye-bye.